Also today in health news, an advisory panel for the FDA could change how the U.S. carries out its COVID-19 vaccine strategy. The FDA has signaled that they want to move to an annual vaccine schedule that allows or follows the model of flu vaccines. And we welcome in Dr. Corey Hebert with the LSU School of Medicine. Good morning, Dr. Hebert. Thanks for joining us.
Good morning. How are you today?
I am doing well. And I want to talk to you about COVID because we've talked about it a million times, but this is a little bit different. How similar would this proposal be to what we already know and is already part of our culture as far as the flu shot? You know, get it. Hey, it's a good idea. Some people don't, some people do. And then we move on and maybe you get sick and maybe you don't. Is this going to be like that?
Well, generally, that's probably what's going to happen here. Now, the reasons why we're going to that two-shot situation for young people and one shot for older people per year is that, you know, we've had the emerging strains of Omicron and Delta and all these things. And our vaccines now, people are not getting the boosters for these different types of strains. And what happens is that if we're not getting the boosters, then we're allowing for more strains to pop out, which means that we're going to have much more deadly disease. And we don't want that. So what I think people are, what the FDA is trying to do today is to say, look, we want you to be able to feel comfortable getting these vaccines. So instead of making it so confusing, instead of making it so you have to remember whether you got COVID, Moderna or Pfizer or J&J or whatever, that we're going to make it uniform so that you go once a year, just get this done. And that will probably be a better way to penetrate the vaccine intolerance and vaccine fatigue that people have right now, to let them get it regularly like they do with the flu shot.
Well, yeah, I mean, less confusing would be great because I honestly don't remember how many shots I've had. I tried to count it and
Exactly.
I just lost track. But I do know the way the flu shot works is that they kind of look at what strains of the virus are going around, I think, in the southern hemisphere during the spring, and then they include those in the winter shot. And I kind of wonder if that's the way it's going to be with COVID too, where they are going to look at all these mutations, but see which one is most common and then try to defend you against that, because one vaccine can't possibly defend you against every strain, especially as they continue to mutate.
Sure, and the same way with influenza. So basically, what we look at countries in the southern hemisphere. We look at Australia, for example, and so what we do is we see what is affecting some of the countries in the southern hemisphere, and obviously some of the continent of the Australia continent. And so what happens is what we have to do is look at that and then say we're not just going to put one of those strains in there. We're actually going to put a multitude of strains that we get from across the southern hemisphere, and then put that in the vaccine. That's what we do with influenza vaccine. So that's what we're going to do if it does get passed. I'm suspecting that it will, because people are a little bit tired right now, and we know that as clinicians. So we need to do something because our vaccine rates for boosters are extremely low.
Could this become like a cocktail? Could they one day just put, vaccination for the flu and for COVID in the same shot? And instead of just getting your flu shot, you get your flu COVID shot every year, or you don't. And that's kind of how we move on from this.
Yes. And I think that what we need to do is remember that, it's not going to take forever for us to be able to get people vaccinated for COVID, because COVID is much different than the flu. COVID-19 is a coronavirus. It's not very complex. It is very simple. So influenza is going to be around for a long time, but I don't think we're going to have to be giving the COVID vaccine for as long as we've been having to give the flu vaccine, which has been over half a century.
Oh, well, that is very hopeful, I suppose. Let me just ask you this, though.
Sure.
Which one of these is more transmissible at this point? Is it COVID or is it the flu?
They're both pretty transmissible. The thing that's the problem with COVID-19 and coronavirus is that a lot of people still have not gotten full immunity and have not had this multiple times. So influenza, everyone has had, if they've had it 15, 20 times in their lifetime. So COVID is still going to be a little bit more transmissible because it has not been, hasn't permeated our society across the world like influenza has for hundreds and hundreds of years. So it's just, COVID is something you still want to look out for because you don't really have a lot of long flu symptoms. We've evolved a little past that. So we just don't want to get those long COVID symptoms. I'm telling you, we are developing an entire new medical platform to address the symptoms of long COVID. So the long COVID is not going away. So please get your shots, folks. I promise you.
Thanks for watching. Go to newsnationnow.com to find NewsNation in your cable lineup. And don't forget to click the red subscribe button below to get more of NewsNation's fact-based, unbiased coverage.